Welcome, everybody. I want to start by saying, yesterday was the anniversary of the Aurora theater shooting, the tragedy. On my Facebook page, Ralph Nadal posted, "One of their hearts is still in a man I know that's alive today, organ donor. Thank you and bless you," to add it to someone's life. So I want to encourage everybody, if you haven't, to sign up to be a organ donor to potentially save the life of somebody else. And of course, we mourn the great loss that our state experienced in the Aurora theater shooting. This pandemic has cost our state many, many more lives. We now count 1,615 Coloradans who have died from coronavirus, over 1,700 that have died with coronavirus. Today, so far, 409 new cases. Total hospitalizations continues to grow. That's a trend we're concerned about. It's at a level that's not at all a threat to our healthcare system. But we watch two things, right? We watch where it's at. If somebody could guarantee us that we could stay exactly where we are for several months, we would be in good shape. The problem is it's nearly doubled in the last 2 weeks. And so what we can't afford is another doubling and another doubling, right? Which is the trajectory. So that's why Coloradans are making great efforts to wear masks and stay 6 feet apart from others. Across our nation, we're seeing distressing trends, worse in a number of states than here. But we are no exception to the national trend. We just have a slightly slower trajectory, but we are very worried that without these corrections that Coloradans are taking and this increased effort for social distancing, that we would risk being a national hotspot. The number of new cases is roughly doubled. We were around 200 per day. We're now in the 400 to 500 range per day, which is why we're hoping that the mask wearing, of course, we haven't seen the impact of that yet, remember, and we're probably just starting to see the impact of the bar closures. That was, 2.5 weeks ago now, so we're starting to see that. But our long-term success really relies on sustainable behavior from people, and that's really what today's going to be about. I want to translate that term social distancing so you kind of know what it means and what it means that we need to do in our everyday lives. It simply means things like telecommuting if you can. And if you're going out, camping or hiking, go with your household or most one other household and try to be 6 feet away from others. Just having one or two people over instead of a larger group. Limiting your groups to 10 people or less. And just taking fewer trips to the grocery store, buying twice the amount of groceries, going half as much. And of course, if you are at all experiencing symptoms, please get tested, and we'll have more on that as well. Our best approach, as you know, is to control the virus locally. The goal is to control it at the site level when there's an outbreak. If it becomes community-wide, at the community level, and only in an absolute statewide outbreak would it be addressed statewide. So a lot of these efforts every day, county health departments on the front line, coordinated from our administration by Director Jill Ryan. She's going to talk about the partnership with our local health departments, also a little bit about what we're seeing about the data by region and how some parts of our state need to take additional steps. Other parts of our state are going forward with opening, even going to the protect our neighbors phase, larger groups, and more of a complete opening. So the key thing, and one of the reasons masks are so important, is that people travel around our state. It's not just tourists from other states that are visiting Colorado that may spread COVID. It's also our fellow Coloradans. So even communities that have no local incidents or very low local incidents, the reason the mask wearing is so important is we want to make sure that when people from Denver or Aurora or Eagle County or Pickens County, when they're visiting southern Colorado or eastern Colorado, that they are wearing a mask in stores and the workers are wearing masks, and that areas of Colorado with low incidence can continue that way and continue to be ahead of the state and not have to worry about some of the things that are affecting the higher virus areas like bar closings or some of the other steps that have to be taken. So it's a very localized approach. We've had that from the beginning with the variance process. We're a very diverse state, and the prevalence of the virus is no exception to that diversity. And we've really embraced that as a state to have tailored local approaches. And coordinating that all has been Jill Ryan and her amazing team, Ann House and others at CDPHE, and I want to turn it over to Jill.
Thank you, Governor. Good afternoon. Colorado is a vast and diverse state, and so not surprisingly, the rate of COVID-19 cases look very different county to county. So this is why in late April, we created a local variance process. Counties can either choose the safer at home public health order, or if they meet certain criteria, they can apply for a variance from that order. The variances, though, have certain limits. But a variance means that a county can have less restrictions from the state order, such as larger gatherings. Colorado counties are our first line of defense. Each county is served by a local public health agency that works with the state health department to test, trace, monitor the spread of disease, educate, and gain compliance with public health orders. Counties know their communities best and the challenge of trying to balance disease suppression with economic stability, and it's a tricky dance. We believe the variance process has been successful in leveraging local conditions, and some counties have held their variance for nearly 3 months. However, the asymptomatic spread of COVID can cause the virus to go undetected and sneak up on us in exponential growth, which we must avoid. As more restrictions are relaxed, we anticipate seeing an increase in cases. The rate of increase, however, is the big unknown. This is an experiment being played out in states across the nation. Colorado has been methodical in our reopening, and these variances are a large part of that calculation. The Colorado Department of Public Health and Environment has a very sophisticated early warning system of metrics that we regularly present to the governor so he can keep his finger on the pulse of the disease. We'll show you what some of those look like. So indicators like the rate of disease, the percentage of positive COVID tests, how successful we are in social distancing. Our early warning system has begun to blink red in a few areas, so this is something that we are monitoring closely. The spread of the disease is increasing in Colorado, and the rate of increase is speeding up. When each county is granted a variance, they're also told to monitor their disease incidence and are provided with the metrics that would require a mitigation plan. Last week, 15 counties were notified that these metrics had been exceeded. Counties then have 2 weeks to reverse their disease trend in order to keep their variance. If they are not able to reverse the trend, the variance will be revoked and the county will follow the state's safer at home order. The department has requested that counties submit a mitigation plan with strategies such as social distancing, like the governor talked about, increased testing and contact tracing, enforcement of social distancing and mask wearing, and increased education. Counties also have the option to just revert to the state's safer at home order, which 8 decided to do in lieu of writing a mitigation plan. We're also tracking counties that don't have a variance, and any county that has had a 2-week incidence of over 100 cases per 100,000 population is considered in the red zone, and we want to work with these counties in partnership during this critical window of time. What is at stake is our economic stability, as every day of a stay-home order is very expensive economically. If we can control the spread of disease on a county level, it reduces the need for statewide disruption. What is also at stake is our children's ability to head back into the classroom, where their education is better served. I have an 8-year-old son, so I know what it's like to be working from home and helping them get their education online. We're at a critical juncture in allowing that to happen, and we must prevent our hospital systems from becoming overwhelmed by the sheer volume of patients. Although we are preparing alternative care sites, like at the convention center, and we have adopted potential crisis standards of care, we hope to never use them. The human toll at that point would be very grave. But we've been very successful thus far, and Colorado could show the world how to live with this virus. But we all must continue to be disciplined. It's critical that we as individuals help our counties to suppress the disease. We should wear masks. We should limit our interactions with others. Those that can work from home should work from home. We are at a critical juncture, and continued success will take all of us. Thank you.
And I want to make sure folks know that at home that with the statewide mask guideline, everybody here in this room is wearing a mask. There is always in the statewide mask guidelines, if you are going to a speech or a press event or a religious service, there is the exception for the person who's giving the presentation. So that's why both Jill and I are taking our masks off while we're speaking. Jill put her mask back on. I put mine on when I was seated there listening. All the members of the press here are wearing masks. And when I can't do social distancing, some of you might have seen in some of my bill signings, I wore a mask the whole time, even while talking, because there were other people that were within 8 or 10 feet. Here we have about 12 feet between me and any other folks, and it's important they're able to hear the words that we're saying at home better, and that's consistent with our statewide mask guidance. So with this data, I want to thank Jill for spreading light. This is kind of the key chart that informs some of the actions we're taking today. What this line shows us is it's the 20 to 29 age group that is leading this spread of infection in our state. Now, what's important to know, and we've seen this in other states, it started with the 20 to 29-year-olds, but we don't live in a world with generational isolation, meaning it might start with 20 to 29, but it immediately becomes part of broader society, their parents, their grandparents, because 20 to 29-year-olds don't live in a bubble. The decisions that they're making don't just affect themselves, we were all, those of us who are older than 20 to 29, we were all that age once, and some of them are more willing to take risks, and we see that in a variety of activities that they do, and this is no exception. But the problem with this one in the pandemic is they're not just taking a risk for themselves. They're taking a risk for older Coloradans as well, their parents, their grandparents, because we don't live in bubbles. And these same 20 to 29-year-olds are going to be working in stores, working in restaurants, and can potentially, and we've seen this in other states, have led to a greater spread of the virus across people of all age groups. And so many, in fact, most young people in our state are doing an amazing job wearing their masks, staying 6 feet from others, and yet we are seeing some engage in risky behavior, and that's I think a psychologist would say that's a normal thing for younger people to do. They engage in riskier behavior. It's part of being younger. They learn from that. But this affects other people. And so we have to make sure that we're all in this together, and that folks who are 20 to not 29 are very much part of our state. We care about their health. We also care about their impact on others. And, we need to have greater social distancing. And so that means getting back to basics. It means for everybody, teleworking, telecommuting if you can. If you can, do it. That's an appeal to companies and bosses. Maximize your percentage of people who telecommute. It reduces the likelihood significantly of an outbreak at your office, which could mean your office has to close for a period of time. Many in the state have had to close for a week or two because they've had an outbreak. You reduce that risk significantly if you have the maximum amount of telecommuting. It means if you're going out, going camping, hiking, go with your household or at most one other household, not in large groups. If you're having friends over, have a small number of friends over. Stay outside. Have 2-3 people over. And I said limit groups to 10 people or less. In all instances, don't have large private parties and get-togethers. Taking fewer trips to the grocery store and retailers doesn't mean buying less. It just means going, once a week instead of twice, or every other week, loading up. And of course, if you're aware of anybody who is not following the safety guidelines and is a danger, call your local public health agency. Very important. Back to young people. I know it's summer. I've said at the last announcement where we had to say that bars and nightclubs aren't safe enough. This is not the summer to party. It's the summer of no parties. Doesn't mean it's a lifetime of no parties. Don't worry. You're 22 now. You'll still be young next year. You'll be 23. You'll be able to have fun, but now is not the time, and we need to modify our behavior. Your own health depends on it. Your own job depends on it, right? If we go backwards, so many young people work in the service industry, the restaurant industry, the retail industry. Those are the frontline jobs that are affected if our state or if a community goes backwards. So our jobs depend on responsibility. Your health depends on responsibility. And yes, your parents' health, your neighbor's health, your grandparents' health really depends on you being more mature. And this is, this has challenged all of us. It's a time where people of all ages have to be mature and handle this with responsibility. And that goes whether you're 16 or 26 or 86. We all have that responsibility to show that responsibility. So where we have seen the cause of some of this spike has been behavior that has been fine and normal during non-pandemic times for people who are 20 to 29, and that includes getting inebriated and socializing with people outside your household. That means late night at restaurants and bars that have converted to restaurants. It means at private parties. And we need to do what we can, but more importantly, you need to do what you can to make sure that we don't let our judgment lapse from social distancing because we're inebriated. If you want to get drunk, nobody's saying alcohol causes coronavirus. It doesn't. Have your 3 or 4 people over in your home and have that small event with them. Not 40 people in your home and not at a bar/restaurant, right? So there's a safer way to do these things in a pandemic. I know part of the fun is being around 80, 100 people. Can't do that now. Learn the new way. Learn to do 3, 4, 5 people. Have fun in a safe way. Today I'm announcing that for the next 30 days, we want to, from the policy side, help improve that responsibility and beef up our public health response. Normally in our state, last call is 2 in the morning. For the next 30 days, last call for alcohol is going to be 10 p.m. statewide. And that means at restaurants, it means at bars that are serving as restaurants. It doesn't mean they have to close. People can certainly stay out as late as they want. There's 24-hour restaurants. They can stay at those. They can be out till midnight or 1 in the morning. But the state of inebriation in a public place is inconsistent with social distancing. And last call for alcohol will be 10 o'clock. People can stay out as long as they like. But if you do want to get inebriated, please do it at home with just a few other people, and don't let your judgment lapse. I'm very irritated by last call laws. The state has a requirement that bars and nightclubs have to serve at 2, close at 2. Let me say that again. The state has a requirement that bars and nightclubs have to stop serving at 2 in the morning. I think that is a bad law. I will be calling on the legislature to give local flexibility for towns that want to allow bars to be open to 4 in the morning or 6 in the morning or whatever they want to do. Nightlife is an important part of our culture. I think that as part of the recovery, towns that value nightlife economically, culturally, should not be encumbered by the state. And the state should not prevent them from being open till 4 in the morning or whatever they want. And likewise, other towns that value quiet communities or a downtown that doesn't run all night absolutely should have the flexibility to continue being closed at 2 or at midnight or whenever they want to require their local businesses to close. So along with this temporary measure, where statewide the last call for alcohol will be 10 o'clock, I want to call upon our Republican and Democratic friends in the legislature as part of the recovery when we're through this pandemic to give our communities the flexibility to have a vibrant, thriving nightlife at whatever hours that they choose to. And that might be the light at the end of the tunnel if you're in your 20s and are missing going out this summer and fall. We hope to have a new normal, and with the cooperation and work with the legislature where there will be an even better nightlife in Colorado when we're through this pandemic. But for now, it's a short-term sacrifice to keep us safe, to keep our economy reopening, to protect our neighbors, protect our friends, protect yourself. Last call for alcohol, 12 p.m. And we value sobriety in public places. Doesn't mean people won't have drinks with dinner, but anybody who has been drunk just knows this inherently. Your best goals around social distancing and your best intents just fall by the wayside if you're in a group of 50 or 100 people where folks are inebriated. Inhibitions are reduced. I suppose that's part of the reason people drink, actually, is to reduce their inhibitions, sometimes around interacting with members of the opposite sex or the same sex. That's, I guess, a reason people do that. And that's fine. People do it for whatever reason, escaping reality, reducing inhibitions. But it is that very reduction of inhibitions that leads to the lapse in mask wearing and social distancing. And Colorado cannot afford that without risking a setback to our economy, a setback for kids returning to school, and of course the loss of life. And in the long run, I hope that we can work with the legislature to allow bars to serve even later, 4 in the morning, whatever local communities want, because last call at 10 is not a statement about the value of nightlife. It is an important part of our culture, an important part of our economy. It is simply a short-term public health necessity in our state because alcohol reduces inhibition, and when people are out late at night, we are seeing that spread in that 20 to 29 age group. And I know that's tough for people who want to get out and party, but this is not the summer to party. There will be a time to party when there's a vaccine or cure, and we've licked this thing. There's going to be a big party that we're all going to be part of. And I hope that we can work to have a new normal that provides more freedom for businesses and individuals to stay open later if they choose, as well as local communities. Here's some data on the bars that helped lead to this decision. So bars are facilities that don't have full food menus. They have at least 5% of their business occurring after 10 p.m. In April and May, the bar traffic was reduced 80%. In June, bar traffic increased. We had about a 50% of the normal flow. And then in early July, and I think this is one of the reasons we've seen the spread come back, people have returned to this kind of socializing environment. Now, many serve food. Remember, we are getting at proxies here. We for a bar to be open, in many parts of our state, they can actually just be flat out open. But in the Denver metro area, they're serving food. But it's not the act of serving food that makes it safe. Food has no bearing on the safety. It's the social environment, meaning bars can absolutely be open. They can be open past 10 p.m., no issue. But they are functioning effectively as restaurants, meaning people can go in group of 4, group of 6. You're with the group you came in with. You're seated at a table, you're having fun, you're having drinks till 10 and food after 10, but you're not in a freewheeling social environment where you're interacting with hundreds of people. So there is a safe way to do business in this world. A number of responsible bars and restaurants are absolutely doing that, including into the late hours of the night. They will continue to. But it is the type of social environment that is this risk factor here, and we've seen that with the increase in late night traffic. Again, more dangerous if it's associated with alcohol. If people do want to go out for a meal at midnight and have a meal, that's totally fine. But as inhibitions are reduced and as those groups that came in together as 4 or 6 drift apart and interact with others, that is where we get this community spread that we are seeing the data on right now. So, the state will continue to make decisions based on how we can move forward with our economic reopening, how we can move forward with protecting public health, how we can partner with our public health departments at the county level, as Jill talked about. Smaller corrections like these, coupled with responsible behavior from Coloradans of all ages, but particularly here talking about 20 to 29, is what's going to make the difference. And look, there's no... This is the tough part here. While we have some impact on exactly what bars and restaurants are doing, we have less impact. It's up to you whether there are house parties. And that is a big part of that 20 to 29-year-old spread. Now is not the time for house parties. I mean, I know you want to do it. You've been cooped up. It's fun. But have 4 people over. Just have 4 of your besties over. It's not the time to have 80 or 100 people over. It'll go from 1 person to 30 or 40 people. And you know what? Even in that age range, 1 or 2 will probably wind up in the hospital. And then not even beyond that, the people of other ages that it spreads to. So let's have fun, safe way, responsibility. No one wants to have to be mature beyond their age, but that's what the times call upon. And I know that the young people of Colorado and people of all ages in Colorado will live up to that responsibility and will shine, and that Colorado can stay an exception to these trends that we've seen in many of our neighboring states, and that we are worried about the early indications of here. Also want to share some good news. Kaiser Permanente has stepped up and added a generous contribution of $500,000 to the COVID Relief Fund, helpcoloradonow.org. I've been out and around the state visiting some of the grantees of HelpColoradoNow.org. Community nonprofits. I was in Greeley and Fort Collins the other day that receive funds. I want to thank Kaiser, and I want to help all of the donors for HelpColoradoNow.org. You can go to that website and donate too. The money goes right out the door to those in need. $300,000 of the Kaiser donation is helping with contact tracing, focusing on cultural competency around contact tracing, and there's another $200,000 through the employee donation program, thanking all of the employees of Kaiser that have done that. And if you work with an organization that needs emergency help, you can apply for these emergency relief funds at helpcoloradonow.org. That's emergency help for community nonprofits that can show that they can get that help right back out to the community. Could be rental assistance, could be medical, and we have a number of great partners that are doing that work. So I want to end as I started by saying thanks to Jill Ryan, thanks to our state health officials, our healthcare workers, our hospitals, our workers, first responders. Our persistence and our responsibility will be the key to our success in the next few weeks and months. And I know that Coloradans across our entire state, across every age category, are up to this challenge of creating a sustainable way to live where the virus is with us, but it doesn't have a foothold to expand exponentially and overwhelm our healthcare capabilities. And crucially, this is a time to stay calm, to mask up, not a time for anxiety, a time for responsibility and caution. And I know that together we can get through this. I would be happy to take some questions.
Are there any places where the state has identified maybe a bar or a drinking establishment where COVID cases came about because of those places being open with alcohol?
There's been we report on the site outbreaks, and they've been across many different categories. Some of them have been bars and restaurants. And we feel confident that as long as the safety precautions are being followed, restaurants are a reasonably safe place to be, with the outdoor seating, with the 6 feet apart, with the mask wearing of people in the back. So what we've seen in a lot of these restaurant outbreaks is that it's 2 or 3 people. Now that sounds, oh my gosh, it's 2 or 3 people. That's actually good news, because if it was in normal times, it would have been a kitchen staff of 18 people that got it and a number of customers. So we are so far the state seems to be effective in county health departments in identifying these outbreaks early, where they are just 1 or 2 or 3 people, and they're not becoming wider spread. We see the large socializing events as the biggest cause of the increase in spread of 20 to 29. Now, a lot of that is in private homes and private parties. But we want to send the right message here, as well as directly impact the piece that's occurring through late night reduction of inhibitions by sending this message that we have a last call at 10 o'clock, and we're very serious that young people should be getting together in small groups and not large groups for the duration of summer and fall as the state addresses the pandemic.
Good afternoon, Governor. It's David Clue with Denver 7. As a parent, I've come to accept that good parenting can include taking some calculated risk with your child, putting them on a school bus with no seatbelts, allowing them to play sports despite the risk of injury, even sending them to summer camp despite a pandemic, because the benefits seem to outweigh the risks. Why is sending a child to school during a pandemic not just another calculated risk that parents should take?
Well, I think you correctly described that. That's a decision that parents across our state are making. My daughter was in 2 or 3 summer camps this year. One was an aquatic one where she got out on the reservoir. Another one was an art one. My son is perfectly fine. He's 8, she's 6. He's perfectly happy not being in camps, and we push him a little bit, but he doesn't want to do it, so that's fine. I hope that they're back in school. This is a very individualized decision. I know that parents across our state, everybody, many parents are just agonizing over this. They're, if they have or their kid has a pre-existing condition, if the kid lives with grandparents in their 60s or 70s, they might be more likely to want to start the year online. Really, every every school district has making sure that parents have access to an online program if they want it. And if for some reason your school district doesn't, there are statewide online programs that are charter schools that you can enroll your child in for the fall. But really every major district is providing that option for parents who want that. And districts are also deciding whether they want to do kind of a hybrid in-person model or look more like the regular school day. But at the end of the day, this, like a lot of things in life, is a very individualized decision. I think that most parents, like me, are relieved that their kids can be reasonably safe at school and want them to have that experience. But other parents do want to be on the side of more extreme caution and at least start out the year in a virtual learning environment, knowing that it might not be as strong educationally because it's not as well validated over time, but hopefully their kid can keep up and might be able to safely re-enter in a physical way at a later date. So I know that not just families across our state, families across our country are really grappling with this here in Colorado as we speak. We have a school choice in our state, so I mean, if you don't have a strong virtual program in your area, you can certainly enroll in any other one in the state. There's a number of good virtual programs, and that's a valuable option for parents who want to take that extreme level of caution.
Ms. Ryan, I'm wondering if you might be able to identify the 15 counties that are at risk of losing their variances, and also I was wondering if the 8 counties that have gone back to safer at home are in addition to the 15, or if those are included in the 15, how that works.
Yes, thank you for the question. So the 15 counties that we notified last week that they needed a mitigation order or they could go back to the safer at home, they needed a mitigation plan or could go back to the safer at home order include Prowers, Mineral, Grand, El Paso, Eagle, Pitkin, Garfield, Douglas, Denver, Custer, Chaffee, Broomfield, Arapahoe, Adams, and Larimer. And then 8 of those decided to go back to the safer at home order. And I do not have that list with me, but I'm happy to get that to you. They were mainly the smaller counties.
So this is kind of an example of that local flexibility. So the counties can just go back to the safer at home, or they can have their own mitigation plan. And much of the state is in safer at home. That is a route where it's database. We know it works, but we also welcome and encourage that kind of local innovation and flexibility because there's different trade-offs, different vectors of transmission in different communities. And of course, the commissioners, the county health departments, they know their communities far better than the state. And so we really want to engage them on really doing their best to contain it in those areas. Telephone?
Hello, Governor. Jesús Carrasquel from Noticias Univisión, Colorado. Gobernador, ¿qué opina de los test de COVID-19 a nivel nacional y su tiempo de entrega de los resultados? Y si pudiera decirme sus recomendaciones a los niños que quieren regresar a la escuela.
Sí, ahorramos demasiado tiempo para recibir los resultados de los exámenes de COVID-19. Necesitamos hacer un mejor puesto nacional en dar la respuesta más pronto de las pruebas de coronavirus. Ahora es muy importante que estudiantes en todo el país tienen la oportunidad para regresar a la escuela. Ya sé que no es la solución para todas las familias. Algunas familias quieren empezar el año escolar en sus casas virtual, pero también es importante para tener la oportunidad para los niños regresar a la escuela en la vía más seguro que posible.
Governor, I want to ask you about Portland, and if you have thoughts on what's happened there and what you would think if federal troops were to be coming to Colorado to protect federal buildings or monuments or something like that. Well,
yeah, we have not had any reports of that in Colorado. I and we have no indication or reason to believe that that is occurring. Obviously, I share the concern that many have that any federal actions are fully accountable, fully transparent, and consistent with our rights as individuals.
Hi, Governor. This is Joe Vaccarelli with Denver 7. With school districts in the metro area, we've seen several different plans or options for people to go back to school, whether it's starting late or starting online exclusively and reevaluating. But based on what's out there, what do you think is the best option for kids to get back to school this fall?
Well, you know, it's a very personalized conversation that families are having across our state, and I think many school districts have polled their families. I hope they're also engaging their teachers in the safety protocols, listening to their teachers, listening to their parents. Districts are hearing, a third of them want to go virtual, and a third of them want to come back, and a third want to go either way. I mean, they're all listening mode and hearing what parents and teachers want, and then they are doing their best, to the extent they're doing the in-person classes, to have the safety protocols, the cohort isolation in place to prevent a case from becoming a site-wide outbreak. And that is part of that goal, to contain outbreaks early, same as other aspects of our society. You want to make sure that you jump on any outbreak early and prevent it from becoming a school-wide or community-wide outbreak, and as well as having the safety protocols in our schools where it can be reasonably safe, of course, for students, for teachers, for others who are student-facing. The state will be a partner in that. We will be sending hundreds of thousands of medical-grade masks to schools. We hope that they purchase additional ones for teachers and personnel who face students, but we will be supplying every teacher in the state with one medical-grade mask per week. We're making that initial commitment of at least 8 weeks. We're hoping we can continue that depending on the supply. We're also hoping that school districts augment that with additional personal protection equipment that they're able to provide. Critically, that will go to all school districts, whether they are in person or not. So if there are some schools that are just starting out for a few weeks virtual, they can then stockpile those masks and they can use them when they do go back. So all the districts will be receiving those.
Governor, would you please go back over just one more time how this last call change will work?
Yeah.
Does it start tonight? Yeah. Is it statewide?
Yeah, very simple. So we have a very bad law in Colorado that says the last call has to be 2 a.m. I don't know why. Most bars have it like a 1:40 because they don't want to get in trouble. And, if you've ever been out at 1:40, they say last call. You order. Many of them close at 2. They don't technically have to close then, but they stop serving alcohol, so they stop making money. So they generally want to close. This is simply saying instead of 2, temporarily, last call is 10 p.m. for alcohol in our state. If you have any kind of those liquor licenses that allow for sale of alcohol. So for folks who experience the last call at 2, this is the same thing. It's just last call at 10. Guess what? Many Coloradans never experienced that, don't know about it, don't live in that world. They go out to dinner at 7 or 8, and they might have a drink with dinner, and maybe they're home at 10 or 10:30, but they're not there at 2 and they're not there at 10. So it's mostly bar-type environments where people are ordering alcohol at midnight or 1 in the morning. Last call at 10, and then I'm hoping that the legislature, we can work with Democrats and Republicans to remove that statewide law and allow, if they choose to, communities to have a vibrant nightlife in the new normal when the pandemic is over as part of their cultural and economic recovery, and allow bars to be open later.
So can the county ask for a variance during this time at all to stay open past 10 o'clock at night?
Well, we have a pause on variances right now, so there are no new variances being issued. This, like other policies, if we open up variances, could be one that areas could ask for a variance on. But remember, we announced a 2-week pause on variances. It's possible that will be renewed. It depends on where we are in another week and a half. It's not permanent, but it could be renewed another week or two. But this would be like other policies. When there are variances, this could be an area that a place could seek a variance on.
It starts tonight and lasts how long, or when does it
the executive order will be in place before the weekend. I don't know whether that'll be tomorrow or tonight, but it'll be in place before Friday night. I would say tomorrow at the latest. The specifics of that would be out. But it is a simple policy. It really is a current law that already exists around 2. This is really that same policy is an emergency provision that is 10 p.m. instead of 2 p.m.
Governor, I want to follow on what John asked. You said you share the concern that many have that any federal actions are fully accountable, fully transparent, respectful of people's civil rights. Can you comment on what's happened in Portland specifically? Has it been accountable? Has it been transparent? Have people's rights been respected?
Yeah. Well, I mean, I only have the same level of knowledge that you have. I mean, I've read articles about it. Because it's not here, I have not received briefings from that Governor Brown or others might have received. So based on what I've read in the press, yes, I have that concern that this is a violation of people's rights, and I don't think we've seen the accountability and transparency. Are there criminal charges? What are these? How long are these people being detained? Are they respecting habeas corpus? I don't have the answers to that. I'm not in a position to get them. The governor of Oregon is. The other governors are. I will be following this in the press, and again, I would be alerted if this were to occur in Colorado and would be more actively involved.
Trump has not named Denver or anywhere in Colorado specifically, but you say you'd be alerted. You haven't received any indication?
I have no indication whatsoever that there's a federal presence or that the rights of any Coloradans are being violated by federal agents. I have not been informed of that, and I would think that would be, people would know about that. Even in Oregon, I mean, anything you do in public, there's going to be 16 people filming it on their iPhones. So whether I were to find out about it that way or through official channels, I'm confident that if it occurred here, we would all know about it pretty quickly. Was there one more from the telephone? Telephone? And then one more from the room.
Hi, Governor.
Go ahead.
Dave Perry, we're sitting in Colorado. Governor, Mayor Mike Hoffman said that he's had a conversation with you about a testing expansion center here. I know that you've spoken about one of the problems with the testing program right now is the growing delay in getting results. If the state expands a testing center here, is that going to exacerbate the delay in results?
So we're going to give on Thursday a extensive update on testing as well as tracing with a lot of those answers. But I think the short answer here is we can walk and chew gum at the same time, and we must walk and chew gum at the same time. Meaning, of course, we are focused on increasing lab capacity. We know we can't count on our national partners for quick turnaround. I have a call later today with Admiral Giroir. I brought up testing in a call with the Vice President yesterday. We are working. At the same time, that front door needs to be wider, right? We can't have one major mass testing center that's overwhelmed at the Pepsi Center. We need to have a network of several across the metro area with quick lab turnaround time and with easy availability for people to be able to get a test. So, of course, we need to walk and chew gum at the same time. We'll give you an update on Thursday about some of the specifics around that work. Last from the room. Yes?
There was a change in Denver. They're now asking for people to wear a mask 3 years old and up. Your thoughts about that? You're asking for 11 and above, but Denver's saying 3-year-olds now.
Yeah, statewide it's over 10, and there's a lot of good science to back that up, and clearly folks over 10 should be wearing masks. My kids wear masks when they are, in stores. I think in Boulder County it's 12 is the age, if I'm not mistaken. Our kids are 8 and 6, and they wear masks. In many indoor environments they have to. In the summer camps where they're indoors they have to, and they do. There's no magic age. The risk of transmission and the risk of symptoms is correlated with age. In fact, there's recent studies that show that older kids, teenagers, 13, 14, 15, high school age, transmit it about the same level as adults. So it's very important that teenagers wear masks in public and obviously over the age of 10. There's not as much clear science about whether there are benefits or what the benefits are of 6-year-olds and 4-year-olds wearing masks. Generally, it's beneficial. When you get down to the very young, it's the issue of does the adult or caretaker or parent spend more time fiddling with it and fixing it and touching it, and is that in fact a negative? I mean, that would be like a 2 or a 3-year-old. I would think most 6-year-olds can hopefully successfully wear masks, but clearly masks are beneficial. There's no question. I encourage everybody to wear them at every age. If you have a 2 or 3-year-old and they can't wear a mask and it has to be adjusted by the parent every few minutes, that's where it gets into kind of a more of a gray area. But no, we do encourage them for people of all ages. It is a requirement for over age 10. But I certainly encourage 8-year-olds, 6-year-olds. If your local ordinance says 3, I encourage 3-year-olds. Everybody should work on that, and it is possible for kids of all ages. And we really want people to do that in a safe way. Thank you all.